Tier 1, Chapter 17. In this chapter, you're going to learn about a protocol that is utilized in the tier system. I want to know what you think about it.
Chapter 17. I am on my way to Washington Park again this morning. It has been a couple of weeks since my last assignment there, which means I may see some of the same patients that I met with last time. I am more stable in the light of day, though worry still subconsciously laces every moment. My talk with Tess did me good. Walking my usual route, I find myself looking for Nick. I don't see him, but I do spot Lily. There are still a few minutes before we hit our first appointment, so I stride over to her. She looks involved in something, so I patiently wait, scrolling through a few patient files. She eventually glances up, noticing me. "Kate, oh my goodness, it's been too long," she exclaims, and we embrace warmly. "Shane told me that you two ran into each other a couple of weeks ago." "We did. We were only able to chat for a few minutes, but he filled me in a little bit. Sounds like you are both up at Highlands? Or at least he is, and they are transitioning you there as well?" "Yes, his most recent scans and blood work suggest that he needs to be exercising in the mornings. It made more sense to swap his schedule rather than change all appointment start times here." I laugh. "I don't know, changing all of the time sounds completely reasonable to me." She smiles. "Right? I don't know what they were thinking." He said he is really loving it. We both are. Change brings different challenges, but I think it's a good thing. It stretches us. We see a lot more uncleared pregnancy up there. I think that's the hardest one for me. Oh, wow, really? How is that happening? I thought Tier 2 pairings were sterilized after one child, I question. I don't see many patients these days, and most of mine are either older or working to transition and therefore putting off pairing. Am I out of the loop on policy? It's a little more complicated than that now. Policy has always required sterilization after one child for Tier 2 qualified pairings, but the timing has changed. Ever since Berg organized the tier system, we've been doing these procedures at the time of delivery. Over the last 65 years, Berg has consolidated more research on patients who have had these procedures done. Some of the statistics are pretty concerning, specifically for the mother. Breastfeeding was more difficult in sterilized women, likely because the body was under so much stress, and recovery was longer than would normally be expected. That makes complete sense. It does. For years, they have been weighing pros and cons of waiting versus doing the surgery immediately because there are obvious risks involved either way. Like uncleared pregnancy, I repeat. Exactly. Waiting gives couples enough time to either purposefully or accidentally become pregnant before the procedure. 2 years ago, it seemed that we had enough evidence to justify waiting 6 weeks to allow the body to heal. Why couldn't they sterilize the father immediately? Berg actually tried that, but it takes a good 6 months to be sure they are clear, and it left the mother with very little support while she was recovering. Pros and cons. Eliminate risk on one side, but increase the risk of depression, mental breaks, and lack of care for the infant on the other. They also thought about requiring the father to go through the procedure before delivery, but sometimes the pregnancy doesn't go full term, and then the couple is left without recourse. What about birth control for the mother? Again, that almost eliminates the risk, but the most effective options we have are not considered fully safe for breastfeeding. Oh, for sure. That's too important to mess with, I agree. That's quite the conundrum. So, how often are you seeing these pregnancies? Is it becoming a huge problem? Not a huge problem. Most women's bodies don't start ovulating again until at least 6 weeks after delivery, especially if they are breastfeeding. Many pairs are also extremely conscientious, making sure to use birth control and take precautions. But we do have some that see it as an opportunity to bypass the rules. You don't think they are accidents? Some are, definitely, but some are not. So how do you deal with that? The same way we deal with any pregnancy: support, nutrition, and education. The frustrating thing is, I know some members of Tier 2 look at pairs successful in seeking out a second child and start thinking about it themselves. It seems like people would recognize that getting pregnant so soon after delivery is a risk in and of itself. Right. And I honestly think if the numbers start going up, Berg will institute policy changes to discourage and condition that behavior. You don't think they would force abortions, do you? No, I don't think they would go that far, but they have been gathering all genetic information on the pairs that are attempting this. If they notice common threads, I wouldn't be surprised if pairs with those markers are not able to have children at all. I whistle. Back to the beginning. Well, it's important for qualified Tier 2 individuals to recognize that the only reason they are able to have one child in the first place is that we have enough resources to allow for it. It used to be that only Tier 1 individuals could procreate, period. If the general population becomes diluted again by disease markers because of uncleared pregnancy, she sighs, well, they may not have that privilege anymore. It's harsh but true. I start as I realize that it is a few minutes past my first appointment. I wish we had all day to chat. I have so much I still want to talk about. I didn't even get to ask you about the kids or life outside of work. We should get together again soon. I give her another hug. I know, I've missed seeing you all the time. Remember when we had lunch together every day? Of course I remember. I only had Tal then. We were babies, she says. We both laugh, and I wave as I head over to my station. A couple of patients are already lining up, and I prep my display with the few screens I will need access to. I pause when I notice the procreation panel, realizing I haven't had to open it in years. After talking with Lily, my service suddenly seems incredibly straightforward.